It's all over the news. Coronavirus is spreading in China. 11 million people. City of Wuhan is placed under quarantine, together with at least 9 other Chinese cities, as possible massive outbreak is feared. Small number of confirmed and suspected infections have been reported all over the world, including countries like USA, Canada, United Kingdom, Singapore, South Korea, Thailand, Vietnam, Japan, and Australia. It's confirmed that this virus have caused at least 41 deaths so far. All of these have happened in China. It's likely that the number is higher than this, as most likely several deaths caused by this infection have gone uncounted, just because they have been confused as the normal flu. What is this Wuhan coronavirus, and does this infection differ from a normal flu? Coronaviruses are a large family of viruses. There are different kind of coronaviruses existing. Some may cause just mild respiratory infection, but some can be really serious, or even deadly. On the other hand, some coronaviruses only infect animals. In rare cases, these viruses evolve to viruses what scientists call zoonotic, meaning they can be transmitted from animals to humans and spread between people. This new coronavirus is genetically similar with the well-known SARS coronavirus, which was identified in 2002, and caused epidemic which affected large number of countries around the world. Eventually 774 deaths were reported in 37 countries because of SARS. Fatality rate of SARS coronavirus was 9.6% on average, according to the World Health Organization. Fatality rate of people over 65 years old was higher than fatality rate of people under 24 years old. SARS virus disappeared around 2004. Although this new virus is genetically similar with SARS, there are also a big differences between these, and the behavior of this new virus is somewhat unknown. The official name of this new virus is 2019 nCoV, or 2019 novel coronavirus. Both SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome, were zoonotic coronaviruses. It appears that Wuhan coronavirus Oregon 2019 novel coronavirus is also zoonotic. According to experts, many of the infected persons were most likely exposed to animals at the Huanan seafood wholesale market, located at Wuhan, where poultry, snakes, bats, and other farm animals were sold. We have to remember that also SARS started from outdoor market back in 2002. According to a recent study, this newly identified coronavirus is recombinant virus between the bat coronavirus and other, currently unknown coronavirus. Findings also suggest that cross-species transmission of this virus from snake to humans may have happened. However, this transmission method have been questioned by some experts. More studies will be needed to confirm the method of transmission. In every case, this new virus is currently fairly unknown, and only the 7th known human coronavirus. How you get infected? As this have been identified to zoonotic virus, you can get infected by being in contact with infected animals. Also human-to-human transmission of this virus is confirmed, so you can also get this from another humans. For example, if infected person coughs or sneezes, flying droplets can easily spread the disease. Touching an object, or surface with the virus on it, or shaking hands with infected person, can get you infected, when you are touching your mouth, nose, or eyes afterwards. Also, feces may spread this virus. Note that it's possible that infected persons can spread this virus before they get any symptoms themselves. It's unknown how long this virus can survive on air and surfaces, but it's known that SARS virus survived about 2 days on plastic surfaces. Similar kind of behavior can be expected. Incubation time, or time from infection to the first symptoms of Wuhan coronavirus, can be anything from 2 to 14 days. Studied cases suggest that it's around 7 days on average. Coronavirus infection starts like any other flu, and may not cause anything abnormal compared to the normal flu. Symptoms can include any normal flu symptoms, like fatigue, a runny nose, sore throat, headache, cough, and fever. Reported cases of 2019 novel coronavirus have included fever in 90% of cases, dry cough and fatigue in 80% of cases, and shortness of breath in 20% of cases. Also, X-rays have revealed some signs in both lungs of infected persons. What we know about Wuhan coronavirus is that it can cause pneumonia, and it doesn't respond to antibiotic treatment. There are a few things that have to be taken into account. If patients have similar symptoms as in pneumonia, and if they have been in contact with previously known infected persons, or in contact with persons coming from infected areas, or if they have been visiting infected areas themselves within the last 14 days, the possibility of coronavirus infection should be considered. Persons with a weak immune system, and especially the elderly and the very young, are in danger, as there's a chance that the virus could cause more serious respiratory tract illness, like a pneumonia or bronchitis to them. It was reported that SARS caused also diarrhea and kidney failures, so these can also be possible. There is no specific treatment available currently, but existing antivirals can be tried, as they may help the symptoms. Of course, if you seem to have severe infection, don't hesitate to seek medical help. It's better to go to the doctor too early than too late. If you know you have been in contact with persons coming from affected areas, or you have visited those areas yourself within last 14 days, and start to get symptoms, seek medical help immediately.